I'm a 17-year-old high school student, and to be honest, I'm a little overwhelmed. So I was wondering if everyone can join me in a quick guided meditation. So if everyone could close their eyes, no peeking, okay. Deep breath in, and a deep breath out. Now imagine this. You're a high school student, and you're late for school. You pack all your clothes in your bag, ignore your messy hair, and just try to make the bus. Now, keep those eyes closed. Deep breath in, and a deep breath out. Now, imagine you're the same high school student, overwhelmed with stress from teachers, parents, and peers, and you don't know how to navigate this pathway. Then, your friend offers you a vape, saying it'll alleviate the pain, even just for a little while. You hesitate, but you take it. Now open your eyes. You're a statistic. According to the U.S. Youth Surveillance Behavior Study, 36.2% of high school students reported using an electronic vape or product. And according to the National Center for Drug Abuse Statistics, found that there was a 30% increase between 2016 and 2020 with drug use amongst 8th graders. This shows increased accessibility. At such a young and vulnerable stage, our youth are exposed to harmful patterns of abuse and dependency. So the question becomes, how do we support them through this process? Schools have shifted from purely punitive, isolative punishments to holistic supportive structures that encompass diversion programs. Diversion programs can be viewed as an exit ramp, allowing students to avoid further penalties through juvenile systems or further school punishment. We can view 3 pillars within student diversion programs. 1, being family involvement, keeping that conversation with these families for how to support their students. Second is pre- and post-screening, allowing facilities to understand students' attitudes towards these substances and allowing them to understand these emotions. Third is focused treatment, allowing facilities to understand students' underlying emotions and reasons for using these products. These 3 key pillars allow the diversion programs to remain as a rehabilitation program and not simply a punishment. Now, North Carolina mandates an alternative disciplinary program. This means that students who are faced with punishment of a long-term suspension of 10 or more days for using these products can have the opportunity to take a supplementary program and shorten that suspension to 5 days. I want to observe how Wake County facilitates this partnership because in 2021-2022 school year, 532 high school students and 32 middle school students were caught with marijuana and vape products. Wake County Public Schools and Southlight Mental Health Facility have an ACE-1 program. This is Alternative Counseling Education. This is a program that encompasses education, emotional regulation, responsible decision-making, and goal setting. This is imperative as it not only educates students on the harmful health effects of engaging in these products, but it also helps equip students with tools to how to navigate these abuses outside of the program. Intervention in schools is imperative, as 90% of adults who meet the clinical criteria for drug abuse addiction have stated to use these products before the age of 18. This is why this similar partnership should be emulated throughout rural counties across North Carolina and beyond. However, there are some limitations to this implementation. Rural counties might not have access in terms of funding or pre-established relationships with these facilities, preventing them from creating rehabilitation programs. Some rural counties just have packets or in-school suspension, again, removing the rehabilitation aspect. However, this framework can still be implemented and enforced throughout the United States. Now, I want to revisit that meditation from earlier. So if everyone could close their eyes again. Okay, deep breath in, deep breath out. Now, imagine you're that same high school student from earlier, overwhelmed with stress, and you're starting to notice your usage of nicotine becomes a pattern. Then you're in school and you get caught. The school administration finds you and you're upset, overwhelmed, and most of all, embarrassed. However, they refer you to a mental health facility where they talk to you and you can understand how to create a structured system of support to prevent this from happening in the future. This is how systems support students as a person, beyond a number, beyond a referral, and beyond a statistic. Thank you so much.